Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Uterine diseases. Introduction. The uterus, or womb, is part of the female reproductive system. It is the place where a baby grows when a woman is pregnant. There are many common problems that can affect the uterus. Treatment for uterine diseases depends on the cause. This program will help you understand uterine diseases. It discusses common diseases of the uterus and how your healthcare provider can diagnose and treat them. Anatomy of the uterus. The uterus is part of a woman's reproductive system. The female reproductive organs include the ovaries, the fallopian tubes, the uterus, the cervix, the vagina. These organs are located in the pelvis, between the urinary bladder and the rectum. The uterus is a hollow, pear-shaped organ. It is about 3 inches long and has 3 layers. The inner layer of the uterus is called the endometrium. The endometrium lining grows and thickens each month to prepare for pregnancy. If a woman does not become pregnant, the lining flows out of the body. This is called a menstrual period. The middle layer is a muscle that can expand a lot during pregnancy. The outer layer is the outer covering of the uterus, known as serosa. The uterus has 3 parts: the fundus, the corpus, and the cervix. The fundus is the top part of the uterus. It is shaped like a dome. The middle part of the uterus is the corpus. This is where a baby grows and stays until it is born. The uterus is able to expand greatly in size. The middle muscular layer of the uterus creates labor contractions, which cause the baby to come out. The narrow lower part of the uterus is the cervix. The cervix leads to the vagina. The vagina opens to the outside of the body between the urethra, which is the urinary bladder opening, and the rectum. Uterine diseases. Uterine diseases are a group of problems that happen in the uterus. Uterine problems may be found by your healthcare provider during a regular pelvic exam. A pelvic exam checks for lumps or changes in the shape of the uterus. A pelvic exam also checks the vagina, cervix, fallopian tubes, ovaries, and rectum for any changes. Talk to your healthcare provider if you notice any bleeding between periods or after sex. This is often the first sign of a problem with the uterus. Some women are at a higher risk of developing uterine diseases. For example, women who are obese are at an increased risk for developing most uterine diseases. This means that obesity is a risk factor for uterine disease. Other risk factors are related only to certain uterine diseases. Some of these risk factors include being older than 35, having a history of uterine disease in the family, prior uterine surgery, taking certain medications. Talk to your healthcare provider if you are concerned about your risk for developing uterine diseases. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Symptoms. Many uterine diseases have similar symptoms. The main symptom of uterine diseases is bleeding between periods or after sex. Other common symptoms of uterine diseases include frequent urination, heavy bleeding or painful periods, pain during sex, pain or difficulty when emptying the bladder, vaginal bleeding after menopause. You may also notice the following symptoms of uterine diseases: feeling of fullness in the pelvic area, large blood clots during your period, lower back pain, reproductive problems such as infertility, If you notice any of these symptoms or other changes, talk to your healthcare provider. Finding a problem early makes treatment easier in most cases. Common causes. Hormonal imbalances and thyroid problems may cause uterine diseases. Changes in the hormones that control menstruation can cause problems in the uterus. Thyroid problems may also cause abnormal bleeding. Pregnancy affects the hormones in a woman's body. It can sometimes cause problems with the uterus. Another cause of uterine problems is infection. Endometritis is an inflammation of the endometrium, the lining of the uterus. It can be caused by certain infections like chlamydia or gonorrhea. Uterine cells may go through changes that can cause polyps or fibroids. Polyps are abnormal growths of tissue. Fibroids are common, non-cancerous tumors of the uterus. Sometimes women with polyps or uterine fibroids don't have any symptoms. Other uterine problems are endometriosis and adenomyosis. In endometriosis, the kind of tissue that lines the uterus grows outside the uterus. With adenomyosis, the tissue grows in the muscular wall of the uterus. Uterine cancer is also a possible cause of uterine problems. The most common type of uterine cancer is endometrial cancer. This type of cancer begins in the lining of the uterus or the endometrium. Tests and diagnosis. To diagnose any uterine disease, your healthcare provider will first ask about your symptoms. He or she may also ask about your personal and family health history. A physical exam may be done to check the body for any signs of disease. A pelvic exam is done to check the uterus for any abnormal changes. Fibroids are usually found during a pelvic exam. Blood tests may be done to check for hormonal imbalances or thyroid problems. Blood and urine tests may also be used to look for certain infections. Sometimes imaging tests are needed. Ultrasounds may be used to better see polyps or fibroids. An MRI or CT scan may also be done to diagnose many uterine diseases. Another test that may be done to diagnose uterine polyps is a hysteroscopy. A hysteroscopy uses a thin, lighted tube to view the inner lining of the uterus. Polyps may also be removed at this time. Endometriosis is diagnosed by doing a laparoscopy. A laparoscopy is a surgical procedure used to look at the inside of the abdomen using special scopes. During a laparoscopy, your healthcare provider may take small samples of the abnormal tissue to make sure it is not cancer. Adenomyosis may be diagnosed after other causes have been ruled out. The only way to be certain of a diagnosis of adenomyosis is after a hysterectomy. A hysterectomy is the surgical removal of the uterus. Treatment. Treatment for uterine diseases depends on the cause. Some uterine diseases are easier to treat than others. Hormonal imbalances are sometimes treated with birth control pills. If a thyroid problem is the cause, medication may also stop the symptoms of uterine problems. Most uterine polyps and fibroids don't cause any symptoms and don't need treatment. Pain medicine may help manage mild pain. Antibiotics are used to treat endometritis and other infections of the uterus. Hormone therapy may also help control hormone levels. This can help shrink uterine polyps or fibroids. It also may help treat endometriosis and adenomyosis. Curettage is a procedure in which the inside of the uterus is scraped using instruments called curettes. This procedure is sometimes done to remove uterine polyps. Surgery may be needed to treat some uterine diseases. Uterine polyps and fibroids may be surgically removed if they cause problems. Surgery may also be needed to treat endometriosis. The goal of surgery is to remove some abnormal tissue and to reduce the scarring that endometriosis may have caused. A hysterectomy, which is an operation to remove the uterus and possibly the ovaries, may be recommended if other treatments are not successful. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. The uterus, or womb, is part of the female reproductive system. It is the place where a baby grows when a woman is pregnant. There are many common problems that can affect the uterus. Talk to your healthcare provider if you notice any bleeding between periods or after sex. This is often the first sign of a problem with the uterus. Other common symptoms of uterine diseases include frequent urination, heavy bleeding or painful periods, pain during sex, pain or difficulty when emptying the bladder, vaginal bleeding after menopause. You may also notice the following symptoms of uterine diseases: feeling of fullness in the pelvic area, large blood clots during your period, lower back pain, reproductive problems such as infertility. There are many possible causes of uterine problems. Causes may include hormonal imbalances, thyroid problems, infection, polyps or fibroids. Other causes of uterine problems may include pregnancy, endometriosis, adenomyosis, cancer. Diagnosis of uterine diseases depends on the symptoms. Blood and urine tests, MRI, and laparoscopy, along with other tests, may be used. Treatment of uterine diseases depends on the cause. Some uterine diseases are easier to treat than others. Some problems don't require any treatment. Thank you for using Explain.